Hey, I'm Dr. Julie. I'm a board certified psychiatrist, and I've been seeing a lot of videos talking about the dangers of people getting veneers performed by people who aren't dentists, the so called veneer techs. And while I think there are plenty of people who are dentists who've addressed the issue about licensing as it relates to dentistry and who can perform what procedures, from a psychiatric perspective, I wanted to chime in on a couple of cases that stood out to me. That also are a reason not to just let anyone be playing in your mouth when they don't have the adequate training and licensure. So this case, which was back from December of 2023, so a few months ago, is the story of an NFL player who died of dental related sepsis young. And so, as a psychiatrist, I've consulted on a lot of cases that of people who have like an altered mental status. And, during the course of the altered mental status, they'll try to find if there is a medical reason to explain why the person is like confused or disoriented, or maybe having other psychiatric symptoms like hallucinations. Sometimes when people get delirious or have an altered mental status, they can have those symptoms. And so sepsis, which is an infection in the blood that throughout the body, is one of those reasons why people can have an altered mental status, and that can happen from having an infection in your mouth. Right, the mouth here and the brain here is close, and it is possible that you can have an infection. That starts here in the mouth that spreads throughout the body, and it actually can go and infect the brain. So you do not want to be getting dental procedures performed by people who do not have an adequate understanding of like gum health and gum disease, and putting things on your mouth where things can be loose and bacteria can get in there. I mean, of course it can affect your teeth and the health of that, but it can also just impact your overall health, including your brain. And this case has always stood out to me. Kimberly Burgley, I think, or Burgess. I'm not sure how to pronounce the last name, but it was a famous case at the time, but she was infected with HIV/AIDS by her dentist. So this is even a case of a person who is licensed, who has been to dental school, is supposed to be educated about all of the procedures and safe practices as far as like bloodborne pathogens and things like that, bodily fluids. And I believe they traced like 5 to 6 cases of HIV/AIDS back to this dentist. So I mean, just think about that. This is a person who had been educated about bloodborne pathogens and bodily fluids, and this transmission still happened. But you're going to show up to a person who is not even a medical professional and let them put things on your teeth, let them work in your mouth. You don't know if they autoclave the instruments. Do they know how to properly sanitize these instruments and things that they're putting in your mouth? Y'all, do not go to these individuals who are not dentists, who are not healthcare professionals, and allow them to put, semi-permanent things in your mouth. Not only could it cause infections in your body that can affect your brain, like I said in the first situation, but literally you could end up, depending on their practices and how they're doing things, with something as potentially severe as a disease from a bloodborne pathogen. So, and not just HIV. I mean, hepatitis. I mean, there's all other kind of things that you can get if people aren't following proper sanitation practices. And just looking on TikTok and look at some of these veneer training classes, y'all do not know who these people are and what they're doing and what they're putting in your mouth. So just please be safe out there. If something sounds too good to be true, it is.